For the purpose of this exam, I've already washed my hand and I've put in on my gloves because I don't want the time to be fast spent. So I'll go ahead and ask the family. Hi.
Hello.
How are you both doing?
Good. And you?
I'm good. Thank you for asking. My name is Grace. I'm an FNP student, and today I would like to conduct head, ear, nose, and throat assessment on your daughter. Would that be okay?
Yeah.
Okay. Hi.
Hello.
What is your name?
My name is Rejoice.
And how old are you?
I'm 11 years old.
Okay, nice Rejoice. I just wanted to know if she has all her vaccinations.
Yeah.
Okay, and does she have any past medical histories that I have to know of?
No.
What about any allergies?
No.
Okay. Okay, Rejoice. With my hands already washed, I'm just going to go ahead and assess your head, okay? So I'm assessing the scalp right now. I start with the hair. The hair is evenly distributed. I could see that the hair is neat. There are no lesions. Do you have any pain?
No.
No lesions, no bumps. Any pain?
No.
Okay. So I'll go ahead with the face. Her face is round. She has her ears bilaterally distributed. She has her eyes evenly distributed as well. Her nose is midline. Her mouth is midline. I could see a little bit of a healing wound right here to the right side of her mouth. And her neck doesn't have any mass, any lesions, any pain?
No.
Okay, good. There is no pain. Great. So, as I said, I'm going to go ahead and inspect her eyes. I will shine my pen light in her face to help assist this examination. I could see her brows, as I said, is evenly distributed. With her eyes, I see that her cornea is white. Her conjunctiva is also pink and moist. There are no lesions anywhere that I see. Okay, now can you open your eyes widely for me? I'm going to shine the light on it and assess for Pearl. Good job. You're doing a good job. Okay, so I would say that Paula is intact. Her pupils are equal, round, and reactive to light. I'm going to go ahead and assess for extra oculomotor movement. So you're gonna follow your eyes with my pen light, okay? Wherever I move your eyes, you follow with the pen light. Good? Okay. So good. So I would say that her extra oculomotor is good and intact. Cranial nerves 3, 4, and 6 are all intact for me. I'm going to be giving you some assignments. You have to cover this eye for me. Cover it. And then you're going to tell me what letters you see. Okay?
E. J. T. O. D.
Good. So we're going to exchange. You're going to move to your right eye now.
E. J. F.
Good job. So this was the test for the snare test, and I would say she has a 20/20 vision. Good job. You are doing good. Now I'm going to move on to her ear. With my otoscope, I'm going to assess her ear. First, I will use my pen light to assist me with the external inspection. So I could see that her ears externally is intact. There are no lesions. She just had a little bit of wask in her ear. Do you have any pain?
No.
Okay, great. So I'm gonna move on to the right side. Good job. Do you have any pain?
No.
So it's similar to what I see, a similar finding. It's also the wax here. There are no lesions or anything or external exudates coming out of the ear. With my otoscope, I'm gonna go ahead and assess the inner. Okay, so I would say that her tympanic membrane is intact. It's pearly gray. Good. And on this side too, her tympanic membrane is intact and it's pearly gray as well. I'm going to be saying something, a word to you, and you have to tell me what I say, okay?
Blue. Red.
Okay, good. So her hearing is also intact. She doesn't have any issues with her hearing. I'm going to move, since I'm still in the face, I'm going to check her sinuses. Tell me, my dear, do you have any pain?
No.
So the frontal, maxillary, any pain?
No.
And it's not palpable. None of her lymph nodes are palpable. And her sinuses is good. Now we're gonna move on to the nose. Can you raise your head a little bit for me? So with her nose, it's patent. Here has a little bit of dryness in this nose, but it's also pink, and there are no lesions or bumps. Now I'm gonna move on to the mouth. Can you open your mouth for me? Ah.
Ah.
Okay, good job. With my tongue depressant is gonna assist me. Can you say ah, sticking your tongue out? Okay, the uvula is present. I'm gonna test for gag. Can you please open your mouth? Okay. So the hard palate is also pink and moist. The gums are healthy and clean. The tongue has no lesions. Okay, can you clean your teeth for me? Okay. The teeth is also evenly distributed. No. And as you can see, the mucosa is also moist and pink. The teeth is clean. Good oral hygiene. Okay, good job. And as we can see, with her lips are pink. As you can see, it's appropriate to her hair color. Good job. You're doing well. Now we're gonna move on for you to taste. Close your eyes. I'm gonna give you 2 drinks and you have to tell me what it is, okay? Can you taste this first? What is that?
Water.
Water.
That's juice.
Juice. Good job. So that was to assess for her cranial nerve 10 and 9 and 10. So now you're going to stick out your tongue. Move it up, down, side and side. So that was also to assess for cranial nerve 12, which is also intact. Can you smile for me? Good. So that is also to assess for cranial nerve 5 as well. Okay, so we move on to the neck. One more time, you're going to swallow for me so that I could check your thyroid, okay? Yeah, so we could see that her trachea is midline. Her thyroid is also intact. As I said, no lesions, no masses, no pain with palpation. Can you move your head to the side, left and right? Up and down. Good job, good job. Any pain? So for this assessment, the ICD-10 code is going to be an encounter of pediatric examination or child examination with no abnormalities. There are a couple of things I would like to talk about. So for your next visit, when you go to see the doctor, it is important that you guys would get vaccinated. Some of the vaccinations that will be available is the Tdap booster. She already took one shot, so this is a booster shot for you to take to prevent whooping cough and also tetanus. And another medication that you have to take is HPV vaccination. That is also going to help prevent any issues with cancer, cervical cancer, in the future when the child gets sexually active. And another vaccination, it's also going to be the meningococcal vaccination. That is another important vaccination that you guys could read about to also get to prevent any meningitis in the future as well. So other important things that we could look at is hygiene. And I know you already having a healthy living. Your gums looks good, so you have to keep up. What do you have to do? You have to brush your teeth twice a day, and you have to use, if dentists approve, you have to use fluoride to help with your gums as well. You have to eat healthy diet, right? You want to grow stronger and healthier. You have to drink a lot of water. You don't want to be doing a lot of sweets. You have to be active, right? Your body is still growing. You may eat a good amount of food, but you also need to exercise to keep you healthy. Another thing you could also do is to limit screen time and do more of other activities. So it could also help you keep yourself in shape and keep being healthy. And other things is you have to get adequate rest, at least 8 hours of rest, right? So you have to sleep early so that you could wake up and go to school. Do you guys have any questions for me?
No.
Thank you so much for this wonderful section.